Welcome back. A new study is raising new questions about what kinds of face coverings we should be wearing. It comes as the number of children testing positive for COVID-19 appears to be on the climb. I spoke earlier with Dr. Imran Ali. Dr. Ali, let's start with the big headline this morning. In the past 12 hours, we received updated numbers on children testing positive for COVID-19. Nearly 180,000 cases have been reported in the past 4 weeks. That's a 90% increase in 1 month. Of course, this comes as so many parents send their kids to school this morning and as so many try to decide whether to send their kids back to school. What are your thoughts?
Well, that report just came out on August 7th from the American Academy of Pediatrics, and it just tells you that the rate of the increase is what's really concerning. And, we know that kids don't get the severe form of the disease, but those small percentage that do get ill either die or become terribly debilitated for the rest of their lives. And as we see more children get infected, we're going to see that number rise. And also, I've taken care of adults who survived COVID, and we're seeing memory problems with adults. So we don't know what this virus can do on developing brains of children. There's so much we don't know about the long-term effects. So it's just so important that we really maintain back-to-school safety and have a good plan to keep children safe.
Researchers at Duke University studied several kinds of face coverings and how they protected people from the coronavirus. And they were very specific about the kind of face coverings that do not work. What are the takeaways here?
I saw the study from Duke University. It was very well done. They used a laser beam to look at respiratory droplets and how they disperse on these masks. And the bottom line is the safest mask would be the N95 masks, the kinds that you see doctors wear in the hospital. But that's not the kind you want to wear every day if you're out and about. They're not very comfortable. So the masks that really do work are the surgical masks and the cotton masks. You have to make sure they have 3 layers, 3 ply. The ones in the study were 3 layers. The ones that did not do well were the ones that were knit and made out of fleece. Also, those gaiters, where people wear them on their necks, they were totally ineffective. So surgical masks, and if you're wearing a cloth mask, make sure it's made out of cotton, 3 layers of cotton.
Dr. Ali, new research shows the majority of states in this country are facing a potential shortage of healthcare workers, and 26 states are expected to face a shortage of ICU doctors. What's your take on this?
When we think of ICU beds, it's not just the bed, it's the staff that makes the ICU tick. Because you can always turn a cafeteria or a medical ward into an ICU, but you need the staff. Staffing is key.
Important points from Dr. Imran Ali. There are thanks to him. And yes, when it comes to the frontline workers, the healthcare workers, it feels like it's a story that at this point is not getting the attention that it got when we first started this pandemic. And so we have to keep putting attention on it.